Hey, Dr. O here, and in this video, we're going to talk about the different volumes that we see in lungs and different capacities that we can calculate. So let's get started. Now, there are four different lung volumes that we can look at when we look at what's happening with our breathing, and one of these is known as tidal volume. And tidal volume is going to be this normal ventilation that we experience when we're sitting quietly. So it's the normal flow of air into the lungs and the air out of the lungs. And it doesn't really require any exertion or any special activity. It just kind of happens naturally. That's what's happening when we're sitting down watching television, when we're doing our studying, just when we're sitting quietly. This is what we see happening. And the word tidal, as you might think, has to do with what we see happening in the oceans, where the tide comes in and then the tide goes out. And that's exactly what's happening with our air. The air comes in and then the air goes out. And normal tidal volume is going to come in at about 500 milliliters of air, so not a whole lot. But then again, we're not doing a whole lot, so there's not a big demand. Now, on either side of our normal in and out, we have these reserve volumes. So one of those reserve volumes is going to be the expiratory reserve volume. And this is the amount of air that you can force out of your lungs after you've done a normal out breath with normal tidal breathing. So if we had our normal breath in and out looking very much like this, so we've now breathed out, there would be a little bit more air that we could force out. And so we could just force that air all the way out, and then of course we'd start to want to breathe right back in. But this extra air that we breathe out, that is called the expiratory reserve volume. So if we needed to do something like cough or maybe laugh, then we've got this extra reserve, this extra volume of air on reserve that we have to work with. And this comes in at about 1,000 to maybe 1,200 milliliters of air. So this is the extra air that we could exhale if we should find that we have need to. Now, just like we had the extra air that we could breathe out if we needed to, we have extra air that we could breathe in. We have an extra capacity to breathe in if we needed to, and that's called our inspiratory reserve volume. So what that would look like is that you would have your normal breath in and the normal breath out, and then a normal breath in, and then you would take in a whole lot more air. And this additional volume comes in, it's significantly greater than what we saw with our expiratory reserve volume, comes in at about 2,100 to 3,200 milliliters of air. So think about when you yawn, for example. You might used to be breathing in and out, and then all of a sudden you just got to take that big breath, that big yawn in. And that's a moment when you're actually moving into that inspiratory reserve volume, taking in that extra air to satisfy that need to yawn. So those are our three active lung volumes: our normal tidal, the extra that we can breathe out, known as the expiratory reserve volume, and the extra that we can breathe in, known as the inspiratory reserve volume. So what is this fourth lung volume? Well, let's have a look. The fourth lung volume is the residual volume. And this is the amount of air that is always going to be in the lungs. And the reason why we have it there is so that the lungs don't completely collapse. Because remember, in the alveoli, that's a very wet environment. And yeah, we've got the type 2 alveolar cells that are making surfactant to help keep those alveoli inflated, but we also have to have air in there to keep them inflated as well. So there's always going to be a little bit of air left in our lungs that we can't touch, we can't breathe it out. And that's our residual volume. And this comes in at about 1,200 milliliters of air. So what happens when we start combining these different volumes? Well, we get into the world of lung capacities. So let's get into that world. So one of the lung capacities is something known as the inspiratory capacity. And in inspiratory capacity, we take the amount of air that we can breathe in through tidal volume, plus that extra air that we can breathe in through inspiratory reserve volume. And when we add those two values together, that is what gives us our inspiratory capacity. So what is our ability, what is our total capacity to bring in air? Well, we have to add tidal volume, because that tells us about how much air we can bring in, plus the inspiratory reserve volume, because that also tells us about how much air we can breathe in. So what about our ability to have air in reserve? How much air do we have in the lungs? Well, that's going to be what we would call functional residual capacity. And that's going to involve our expiratory reserve volume plus our reserve volume. So we take those two together, and that is what's going to give us our functional residual capacity. So we've talked about the entire amount that we can breathe in, and we've talked about the amount of air that we always have on reserve by looking at what's there at in expiratory reserve volume plus the residual. But what about the amount of air that we could move completely? Like all the air that we could breathe in plus all the air that we could breathe out. Well, that's called vital capacity. And so in order to calculate that, we have to take the normal amount of air that we can breathe in, tidal volume, plus all of that extra air that we can breathe in, called inspiratory reserve volume, plus all of that extra air that we could breathe out, otherwise known as expiratory reserve volume, and add those three values together, and that would give us our vital capacity. Now, having added up all of these different capacities, these different volumes to get capacities, there's one more capacity that we need to talk about. So I wonder what that is. Well, that would be the total lung capacity. And in order to calculate total lung capacity, we would have to take all the air that we normally breathe in and out, plus all the air that we could breathe in extra, and all the extra air that we could breathe out, plus all the air that stays in the lungs all the time that we can't do anything with. And that is our total lung capacity. So let's do a little application based upon what we've just learned. So let's say that we had a patient who had a tidal volume of 475 milliliters, an inspiratory reserve volume of 1,950 milliliters, and an expiratory reserve volume of 1,000 milliliters. So a question we might be asked is, what is this patient's vital capacity? Well, you might remember that vital capacity is going to be equal to all of our air movement volumes, such as our tidal volume, our inspiratory reserve volume, and our expiratory reserve volume. So for vital capacity, we're going to take the three values that we measured, and we're going to add them together. And when we do that, the value that we get is 3,425 milliliters. So another question that you might be asked is this vital capacity normal? Well, if we just look at the chart that we have right here to try to figure out what normal is, we know that the lower end of normal will come in at about 1,000, right here actually I believe it's about 1,200, and the upper end is going to come in somewhere around 6,000. And the difference between 6,000 and 1,000 is going to be 5,000, but we have this extra 200 right here, so if we deduct that, it's going to be about 4,800. So we can just kind of rough it just by looking at the chart and assume that vital capacity should come in around 4,800 milliliters. So is our patient's vital capacity normal? And we'd have to say no, it's actually coming in on the low end because it's 3,400. We would expect something closer to 4,800. Is the inspiratory reserve volume normal? Well, you could look at the chart and kind of do a calculation, and it should come in somewhere around 3,000, depending on the patient, maybe 2,100, as low as 2,100, maybe as high as 3,200. And our patient is coming in at 1,950. So it's even low for the low end. And so we would have to say, no, it's not really normal. It's a little bit on the low side. What about the expiratory reserve volume? Well, the expiratory reserve volume, there's not a lot of variation here. It can range from about 1,000 milliliters to about 1,200, and we can kind of see that on our chart, or we can refer back to the numbers that we were given earlier, and we can say that, yeah, this is probably pretty normal, falls within normal. So these are some ways that we can use the information, at least within this little mini lecture, to apply that information and do some calculation and figure out patients' capacities and determine if they fall within what we consider normal. Now, the textbook that you might be utilizing may have some numbers that are a little bit different than the ranges that I have here. So you be sure to use your numbers out of your textbook in order to do the calculations for your class. And with that, we're done with our tour of lung volumes and lung capacities.